I'm Thomas Baldrick at ASH 2014, joined now by the one and only Dr. Esther Oliva from Italy. Thanks for stopping by.
Thank you for inviting me.
Let's talk about AML and the elderly segment. What is the significance of this to you?
Well, the AML elderly population is quite, it has dismal remission rates, so it's a big problem in the community, and it is difficult to get them in remission and to keep them in remission. So what we try to do in the best scenario is to give induction chemotherapy if they are fit, but what we have at the end is at 2 years, about 10% of patients are actually surviving in remission. So what is important is to keep them in remission and surviving longer compared to the younger patients that have much better outcomes.
Tell us about your study, what you did and what you were looking to accomplish.
Well, this is a phase 3 randomized trial, prospective. It's a national trial, multicenter. What we did was we randomized patients to receive the hypomethylating agent azacitidine to observe disease-free survival after having accomplished a complete remission through induction chemotherapy and consolidation. And we have now done an interim analysis, and what we observed is that in 25 patients randomized amongst 88 patients receiving induction chemotherapy, what we had is a benefit in terms of disease-free survival. Complete remission rates are 3 times higher in the azacitidine arm with respect to the best supportive care arm. And this means that disease-free survival was not reached, median disease-free survival was not reached in the azacitidine arm at 2 years observation compared to 14 weeks in the best supportive care arm. So this is quite an accomplishment. We also observed 80 weeks of overall survival compared to 40 weeks survival in the best supportive care arm, so that although this is not significant, it might be promising in terms of overall survival.
You say it's not significant. What do you think the impact is of what you found?
Well, I think that when we enroll enough patients, the curves will receive the p-significant value that we're looking for, because it's already a 2 times longer survival in the azacitidine arm. Also in terms of safety, patients are doing quite well. We observed only neutropenia as a grade 3-4 adverse event in the azacitidine arm. Grade 1-2 adverse events were equally distributed in both groups. So it's well tolerated, and it does maintain patients surviving better and longer. The maintenance arm received azacitidine on a 28-day schedule for the first 6 months, and then they were receiving azacitidine every 2 months. So it's even tolerated in a way that patients aren't coming into hospital very often to receive the maintenance treatment.
So where does your research take you from here?
Well, we are continuing to observe the patients to see whether the overall survival will be better in the azacitidine arm. We will be looking for factors that might be predicting response, and so we can better select patients for maintenance therapy.
Okay, we'll leave it there. Thank you very much for your time and sharing your work.
Thank you.